Hi, good evening. This is Bob McBride, Superintendent of Lockport Township High School District 205. And it's about 6:56. I'm coming to you from my office, and we'll give it about 4 minutes. We're doing a webinar tonight, just some explanations from me about SHIELD testing, SHIELD of Illinois. And I see that there's already 29, 26 people on right now live. One of the things that I would invite you to do is in this webinar, as I explain some key features briefly. We don't expect this to be very long, really driven by your questions. It's an opportunity for me to give you some explanation of why our Board of Education has included SHIELD in what we're doing this year to keep students in school, go to school 5 days a week, and really keep students out of quarantine. That's really what this is all about. But I would really encourage you to use the chat. I have a few people who will be monitoring the chat. I'll be looking at the chat. And in many ways, that will drive the questions and the responses that we give as we go through with a variety of different topics on SHIELD. I apologize if you have a soundtrack to tonight's webinar. Right outside my office is the LTHS marching band, and they sound as good as they have ever been in terms of just their sound, their quality. So please feel free to go ahead and use the chat. It should be, if you're on YouTube, to your right. As I kind of get into the webinar, any questions that you have, any topics that you would like to have addressed, I would be happy to do that. So welcome to my office. Welcome to this evening as we all settle in. We're hosting this webinar primarily because we have welcome back days coming up this week, and we already had freshman orientation today. We did not count up all of our SHIELD enrollments today. We just had a nice stack of SHIELD enrollments where families were choosing to be part of SHIELD. And as we get into the webinar, once things started about 7 o'clock, I will be explaining to you some districts have gone with a mandatory SHIELD testing, and families then have to opt out. You have to tell the district, I don't want to be in this. I'll explain why we felt it was important for our families to give consent, to actually say, I want to be in this program. I want to make this choice for myself and my family. We just think that's awfully important. I'll explain that in just a few minutes once we really get into things and get started with things. I appreciate all of you that are coming on board in this conversation in a place that many of us never expected to be, in a global pandemic that has probably challenged you as a parent in terms of your decisions and your leadership of your family. It certainly challenged us as educators. And, just once again, if I gave a singular theme to SHIELD and all things you'll see us do, is our goal is to keep students in school this year. Keep those school doors open 5 days a week and keep that learning going, because what we know is our most valuable resource are the educators, the 600 educators that work in this district, and your students. If we can put our educators together and your students on a daily basis, 5 days a week for a whole school year, we know we can have a powerful thing. So many of the things that people have talked about with student mental health, wellness, have been related to the sense of isolation maybe that we've all felt through this pandemic, related to times that we couldn't be together, times that we couldn't have human contact. You might ask yourself, well, gosh, Dr. McBride, if human contact is so important, why aren't we in the auditorium? Why aren't we live and in person? We'd love to do that. But we've also found that convenience matters to you. More and more of you are coming on board to this webinar. And what I understand is you're at the end of a very, very busy day, whatever you were doing. And if we can make the work that we do more accessible to you, easy for you to speak to and be in part of and involved in, if we can save you a drive up to East Campus or Central Campus and still provide you with the information, that is something that we definitely want to do. We're in about 7:01. I usually like to give it 2 minutes. Sometimes people at home, they're coming on the link and it takes just a minute to get in. And so rather than repeating things that you might have heard already, and then a question comes up in the chat, we'll kind of give it till about 7:02. Once again, I'll be presenting, and we would invite you to use the chat. I have a few moderators that will be helping. If they see a question, they will answer it. If I see a question, I'll try to answer it in this very brief webinar. I anticipate that the webinar will last, somewhere about maybe 20 minutes to a half hour to give you an introduction to SHIELD. So I'm going to go ahead and get started. First and foremost, thank you again for being a part of this webinar, for being with us this evening. We know your time is valuable. You cannot get it back. You could be doing something else, but you're spending it with me. If you're just coming on, again, I apologize if you hear the soundtrack of the LTHS marching band. They are practicing right outside my door. To start with, we hope that you could access either through our website or an email that we sent out, or the forms are available at freshman orientation and welcome back days just right there. There are two forms, I guess I could call it, that we have sent out. One is a letter explaining SHIELD, but very brief. And then the other is a consent form. And I want to get in with you everything that we're doing with SHIELD. So first, I want to share with you the history of SHIELD. SHIELD was developed by the University of Illinois. I think that's important for us as Illinoisans. We are very lucky. And I just saw a question, quarantine. I'm going to get into that. Thank you for asking that. This is really about quarantine, to be honest. But SHIELD was developed at the University of Illinois, and it's important because we have a flagship university, one of the top public universities in the country. So scientists at the University of Illinois developed this with the same idea that we have in mind. And that was, how could the University of Illinois, with 60,000 people last year on its campus, stay open and not send people home? What it did last year is it sustained learning at the University of Illinois through robust testing. I happen to have two nephews at the University of Illinois who participated. And what SHIELD is, there's a major difference that I want to stress in its history and its approval. It presently is the most sensitive PCR test out there for COVID-19. What does that mean? What that means is that if any of us right now decided that we were going to go and we were going to get a PCR test, and that's critical because right now in schools, a PCR test, according to public health guidelines, is the only thing that we can accept. I know many parents have asked about antigen testing. Many parents have asked about rapid tests, but PCR tests are the only thing that we can accept. If you and I right now went to get a PCR test, we would be told two things. One, that we should have waited 5 to 6 days after we were exposed to COVID-19. And then we would also have to wait 12 to 24 hours to get our results. So maybe on day 7 or 8, we would have our results. The reason why is all of those other PCR tests are able to detect the growth of a viral load in our bodies after about 5 to 6 days. What SHIELD can do that those tests can't is SHIELD can detect that viral load in 2 to 3 days, quicker than any other test. That's critical, some of the questions about quarantine, because if we can get those test results back sooner, it is key to helping us keep students in school if they're exposed to COVID-19. So that's a critical history of SHIELD, developed at University of Illinois, flagship research institution right here in our state, kept the University of Illinois open all last year with a positivity rate below 1%. So why would we enroll in this? There are a number of reasons why we would enroll in this. Last year, SHIELD was piloted in a number of school districts, and talking to superintendents in those school districts. One of those superintendents was a Lockport parent, Dr. Victor Simon. Very positive results. But last year, our central problem was quarantine. And a number of the speakers addressed this. Quarantine and shield. Our problem last year was quarantine. We had a number of times where, due to public health guidelines, we had to ask students to be on a 14-day quarantine due to exposure. We had no way for students to test back, come back if they had no symptoms. That was difficult for families. It was difficult for students. It was difficult for their teachers. So towards the end of the pandemic last year, we began looking for ways that we could limit quarantine. We advocated to the state, rather than 6 feet being the distance for close contact, many of us were finding that 3 feet was a safe distance. That happened. The state has approved that. We advocated for a test that could help students come back. Shield was made available to, at first, districts of our size and finances, but then ultimately every school in the state. We advocated for using metrics drawn from our student population, not looking at all of Will County, not looking at the zip codes that we serve, but looking at our students. How much COVID-19 is in our student body? Can we help make decisions about school based on based on that positivity rate? Someone just asked about the idea of testing healthy students. That's a great question. And the reason for that is to get that student positivity rate. It's not only to get that student positivity rate, but if you can early on detect a student who might have positive COVID, you can prevent that student from being a close contact to other students. And it all kind of comes back to preventing quarantine. The state is providing this at no cost to the district, and it's providing it at no cost to individual families. I want to spend just a minute speaking about cost. We have no financial incentive to participate in Shield. There's no incentive program that the state has. There's no funds that the state is sending to Lockport Township High School District 205. The state, regardless of our decision to join Shield or not join Shield, used federal money to fund Shield testing in schools across the state. Whether we joined or not, that free testing was going to be available to many schools. And we felt if there's a tool that can keep, one, our students in school and out of quarantine, and two, help us have the best data possible about the level of COVID in our student body, why would we say no to that? We're glad we said yes in June, because many schools across the state are signing up now and will not be able to get their programs running until late September. We'll have, we hope, really great data be up and running as quickly as possible. Also, surveillance testing, and this kind of comes back to the questioner's question about why test healthy students. It's one of the recommended strategies. It's one of the strategies that allows us to use 3-foot distancing. It's one of the strategies we hope that will get us to maybe a different situation with face masks, because again, we'll have absolutely robust data on how much COVID is in our actual student body. In addition to quarantine and trying to limit quarantine, trying to limit close contacts between students, keeping students in school and not unnecessarily separating them from school, Shield also has to do with vaccination. We know that's a sensitive issue. We know and believe and embrace the vision that that is a parent's choice. Just like Shield, vaccination and Shield are a parent's choice. We knew going into this year that some families would vaccinate their children. Some families would select not to vaccinate their children. We wanted an option for both of those families. If your child's vaccinated, your child might come down with a cold. Your child might come down with a stomach malady. The symptoms of those issues masquerade as COVID. How do you rule out COVID? If your child has a cold, a sore throat, how do you rule out COVID? We enrolled Shield testing to give vaccinated families an opportunity to test, clear up that issue, and not be in quarantine. Because if a vaccinated student has symptoms, that student could be in quarantine. We know some families didn't feel comfortable with the vaccine. We respect that choice, but we wanted to have options for those families as well. So for those families, if there's a close contact and the student is not vaccinated, we wanted to have a testing protocol that could help them stay in school. And I'll explain that in just a moment, how that helps students stay in school. So how does this thing work? Okay, if I sign my student up for Shield, what does this look like? What's happening in school? So a number of things are going on. Shield of Illinois, University of Illinois, is the overall organization that is running this. They have assigned us to partner with an organization called Visit Healthcare, which is a healthcare company. Visit Healthcare, their staff does all of the specimen collection, does all of the transporting that to a lab, does all of the data reporting to parents and to the school. They're also responsible under HIPAA and FERPA of setting up a secure data portal that is secure for you as a parent receiving the results, secure for the school. We take as seriously as you all the health information that we have about students. We take that very seriously, and it was important to us that that was secure. The LTHS nurses receive the data, but they would be the people responsible for reaching out to you. You probably would receive your data even before us, reaching out to you, and then if there's a positive case, and only if there's a positive case, talking through what would happen next. What would the steps be if there was a positive case? The final thing to make this work is consent. You would have to provide consent. We're asking this week. We want your affirmative consent. Rather than an opt-out where you have to tell us we don't want this, we'd like you to opt in, to sign up, to say this is something I really want to be a part of. So what does your student do? Your student would basically, this is a sample of saliva. And I hate to use the word drool, but drool is the word that Shield uses. We ran a pilot this summer. It was fast, it was efficient, it was effective. It kept programs, athletic programs this summer open. Students became very good at Shield testing. The Visit Healthcare staff, very good at working with our students. In essence, what would happen, it takes about 2 to 3 minutes once a student arrives at the site. The student receives a vial. They're the only person who touches the vial. They drool into that vial with a sample, about that much drool. They take the cap off. They close the cap. They place the cap in a container. On the vial, it has all of their information. Those samples securely are transported to a lab. When I did Shield testing just to try it, a lab at Loyola University in Maywood tested my sample. Within 12 to 24 hours, you as the parent would receive the results. You would be told when the sample was collected. You would be told when the sample was tested and where it was tested. And then you would obviously receive a negative, inconclusive, or positive result. I want to mention an inconclusive result because one piece of Shield is students should not eat within an hour of giving a saliva sample. Oftentimes there's an inconclusive if they've been eating. So in terms of when in the day, we're looking at trying to come up with a schedule that makes this easy for students in the morning. Could be before school, could be during their advisory period, Compass. We might even have a lunch option before they eat lunch. The important thing with that is how many students sign up. How many students sign up will really determine our schedule. If we have thousands of students sign up, then we'll have to pick a time where we can accommodate that. We will not and do not want to pull students out of their classes. We know how important that live in-class experience is. Also, if we have thousands of students sign up, students might only once every 3 weeks Shield test, and then Shield test if they have a need, a close contact or symptoms, for example. That would still provide us with data that we could use. They would still be enrolled in the program. So if they were a close contact or they had symptoms, they could take advantage of Shield. As I mentioned earlier, just in terms of how often, right now, with the positivity rate around us, Shield would recommend every student enrolled in the program does their Shield testing once a week. But if we have a high volume of students, we don't want to interrupt class, we're not going to be able maybe to do once a week. We might do once every 3 weeks, once every 2 weeks. And as I said, a student enrolled would have the option, if they needed Shield testing, to do so. Again, why might this be for you? Your child might be vaccinated. And in that case, if your child comes down with COVID-like symptoms, maybe from something else, Shield could rule out COVID. If your child's unvaccinated and a close contact or symptomatic in quarantine, Shield could also be very helpful in ruling COVID out and helping your student stay in school. I just want to make a mention about quarantine and then maybe take another look at some of the questions in the chat. We do not yet have from Illinois Department of Public Health what they call their exclusion chart. This is their rules for putting students in quarantine and reporting it to your local health department. What they've given us are different options. If you as a parent, your child has symptoms or is a close contact, you could just elect to say 14 days, my child will be in quarantine for 14 days. Or you could say, my child will be in quarantine for 10 days. And if not symptomatic, I'll have my child come back. But in that case, for the next 4 days, the child would have to fully mask, whatever stage we're in. Or you could say, privately, you're not enrolled in Shield. 5 or 6 days after contact, I'll get a private PCR test. If that comes back negative, on that 7th or 8th day, your student would be able to come back. Or the state has created and approved something called Test to Stay. Let's say your child is an unvaccinated child, is exposed to someone with COVID, showing no symptoms at all. Day 1 after exposure, day 3, day 5, and day 7, your child could test with Shield if enrolled in the program more frequently and stay in school as long as they are negative. And so we would set up a system for students in that situation who need more frequent testing in order to avoid being placed in quarantine and want to stay in school. We have a lot of options with quarantine, but the option that we're looking to avoid is students being on quarantine at all. If you give me a moment, lots of really good questions that I might just happen. One person said, what happens if we're not comfortable and we opt out? If you don't join Shield right now, you could always in a month say, I want to enroll. It is a situation where, let's say you had a reason today, my child's been exposed, I want to be in Shield. It wouldn't be a situation because the need to set up a secure data portal that someone right on the spot could get you enrolled in Shield. There'd be a few days of delay getting you into it. So you can certainly opt out now. And then in terms of these quarantine issues, our nurses would work with you in terms of what you need to do, and if that is an experience that your child has. Does Shield offer testing? Does it screen for flu or meningitis? It does not. So it is not a test for flu or meningitis. Where is the HIPAA privacy? Does the school get the results or just the parents? Both. We only receive the results if it is a positive. You, of course, receive your child's results. You are in charge of your child's results. We at school have a very, very high bar. As you know, as parents, we have a health file on your students. We have trained nurses who both are aware of HIPAA and FERPA. And we have other vaccination information and other health information you've asked us to have about allergies and other life-threatening issues. We're required to keep that private and secure. We would only be sharing what needs to happen if there's a positive with you and with any relevant personnel like teachers who need to be aware of that. But that's never a situation where we're sharing your child's name or your child's information, in a personally identifiable way. Great question. Just want to. Someone asked, "Hey, if they're vaccinated, could my child still be quarantined?" You could be if you have symptoms that look like COVID symptoms. You could be in quarantine. One reason why we selected Shield is Shield could be a way to rule that out quickly, rather than waiting 5, 6, 7, 8 days for a PCR test at off-site. Shield could be something that in 2 to 3 days could identify that your child does not have COVID. You're just a vaccinated individual, maybe with a cold. That's it. If a child is a close contact but no symptoms, and a parent does not consent to quarantine, will the school accept a CVS rapid test negative report? That's a great question. We can accept a PCR test, but we can't accept that PCR test. The earliest we can accept it is day 7 after exposure. So because the PCR test available at a place like CVS are authorized to detect COVID on day 5 or day 6. So we could receive that day 7. That just is an awfully, that's a 7-day delay. However, that turns out to be. We're hoping something like Shield could be much, much quicker. Just taking a second to see if there's any other questions I haven't asked. If a vaccinated student tests positive but has no symptoms, do they still need to quarantine? They do. Anyone who tests positive for COVID-19 does need to be in a quarantine protocol. If those symptoms don't persist for 10 days, they're on their way back. If there are no symptoms, I thought one could have a positive Shield test. I thought one could have a false positive Shield test if you are vaccinated. We've had more discussion this summer, and that is not the case. That a vaccinated student could have a false positive. So just sharing that. What's the difference between Shield test and PCR test? Great question. Shield is a PCR test. It uses the same technology as a nasal swab that's a PCR test. The difference is Shield's sensitivity is quicker. It can pick up a viral load related to the COVID-19 virus and all variants of the COVID-19 virus right now within 2 to 3 days, whereas the PCR tests that are available at our pharmacies can't detect viral load until 5 to 6 days of infection. So it's quicker is really the major difference. In quarantine this year, many of you might know there's a question about curriculum, and many of you might know that the state of Illinois has really taken us back to 2019 in terms of remote learning, and has really indicated that remote learners can only be a very small subset of our population who qualify medically, so that students should be in school. As a result, we're prepared to use Google Classroom, the lessons we learned last year, to give students who might be in quarantine materials to keep them moving forward so that they're still connected with their teachers. Also, our Board of Education has created positions we call quarantine interventionists. It's almost like a quarantine coordinator for your child. So as students go on to quarantine, it's a human being who's a member of our staff who's connecting with them and making sure that they stay current. I'm just checking the chat from some earlier chats that I might have missed. I hope I answered the question about an external agency. If an external agency, CVS, when in the quarantine process, we would be able to accept a negative PCR test. The earliest is day 7. When will students be tested? If all students who opt out will be tested twice a week. Right now, we would only, the protocols with Shield are really once a week. I can't imagine a situation where we would test twice a week. Not something that I can imagine. Which medical institution will be processing the tests? Currently, the medical institution that's been processing our tests, our labs, have been Loyola University in Maywood. I should say Loyola University Hospital in Maywood, their lab. You also, if a different lab is used, Their license, it's called a CLIA license, that's included in your report that they do have a CLIA license. That's where our results from a small pilot this summer went. Why there's a question, why isn't there an option for students to be tested only when showing symptoms? A great question. The reason why that is if you're not enrolled in the system, then we can't connect patient to test and securely provide you an answer. So it's very difficult to have a secure portal, a patient registered, so to speak, and just a walk-up situation. So that's the reason why that is. Just looking at other questions. I have if I choose not to be vaccinated, how many times a year would my student be subjected to PCR? That will really depend if you're enrolled in the SHIELD program. It's going to depend on how many students are enrolled in the SHIELD program. Like I said, if we have a very high volume and we can only service, testing for surveillance testing once every 3 weeks, then that's what we'll have to do. And if we do that math, the hope in the state of Illinois is SHIELD's contract with the state of Illinois lasts through December 31st, 2021. The hope is that beyond December 31st, we will be out of this crisis and SHIELD testing will no longer be necessary. That's why the contract only lasts that long. And again, that's a financial crisis contract between SHIELD of Illinois and the state of Illinois. We have no financial relationship at all, either with SHIELD or with Illinois Department of Public Health in this regard. This is a process and a procedure and a test that's being offered at no cost to every school district in the state of Illinois. I'm looking at, I just want to maybe respond to, it's my question, the schools should teach kids math, history, language, health, and schools using our kids like laboratory muscles. I think I'm understanding that question correctly. I would say if a person feels that way, there's no obligation on your part to enroll. If you have a discomfort as a parent, there's no obligation to enroll. But what I would tell you is something I shared at our board meeting last night. Last year, as many things were happening around us, we had evidence that what was going on among our students was different than what was going on in the adult community. We had no way to prove that other than our rate of COVID, other than our rate of quarantine. We would look out at times of higher spikes like last year in October, November. We would see many adults diagnosed with COVID. We would not see that among our student body. But we didn't have a way of substantially showing that there wasn't COVID among our students. SHIELD's one way that we can do that. We can have our own metrics, we can have our own positivity rate, and we can make decisions based on that positivity rate and just have a firmer data point to say, we feel pretty safe. We have been doing SHIELD for 3 weeks or 4 weeks, and we don't have a lot of COVID among our students. That puts us on a really firm basis to begin easing other mitigations off. And ultimately, that's our goal. That's where we want to go. We hope to see that, a day when all of these mitigations and procedures and preventions are a thing of our memory and a thing of our past. That's the goal. Ultimately, to really return things back to normal, to the way that our students know things, and that you know things and you do things. Just want to make sure I'm answering all the questions here. If a student is quarantined, they will receive instruction from 2019 when remote learning was just started. I'm sorry, I probably did a bad job answering that. So maybe let me separate two things. Maybe one, how will we provide assistance? And then two, what the state is saying. In essence, what the state is saying is my reference to 2019 was that in 2019, we could only offer remote learning on 5 emergency days a year. We submitted a plan to do that. If we had a snow day and didn't want to take that snow day, we could provide online instruction. The state has gone back to that and said, well, you can also offer remote instruction, full remote instruction to students who have a medical qualification. So we have to have a plan for our students who could be in quarantine. We developed systems last year, delivering materials to students through Google Classroom and delivering help, support, and questions that could get answered through what we call quarantine interventionists. These are our employees who are going to dedicate time after school to making sure that students that are on quarantine are connected, are current, and with their schoolwork and any problems they might be encountering in terms of that. So that's how we would actually provide that. Um, I think Janine Wheeler answered that question. Someone is asking just a question about the numbers post of how many kids actually contracted COVID from close contact in school. That's a great question. We did post that last year. We had 7 instances, known instances. We don't profess to know everything. But last year, we posted on our COVID dashboard 7 known instances of students contracting COVID from contact in some form of participation here on campus. And we believe that the reason why there wasn't a contraction of COVID were because of all the mitigations that we had in place. We had masking in place, social distancing, ventilation, cleaning. That combination, we believe, kept students from contracting COVID. It also emboldened us to say to the state, gosh, we had 6 feet apart, but we think we can do this at 3 feet apart. Please help us bring all of our students back into school. We can do it if they're 3 feet apart. Is there a minimum number of students needed to have shield testing take place? There is not. We've already made a relationship with Shield of Illinois. They've already signed us Visit Healthcare. And after this week, after we see the number of families that would like this service, we will create a schedule to provide that for students and make it easy and convenient. Like I said, it is probably a 10-minute total process of a student leaving a space or a car if they're arriving at school or a classroom, going to the shield testing room, probably total about 2 to 3 minutes to actually complete the test, and then maybe a couple of minutes to get back to where they are, maybe 10 minutes tops. Some schools that piloted last year, Shield, literally students were on their way to a class. They cut through a gym where Shield testing was taken. They kept on walking, never stopped, right out the other entrance of the gym and right onto their class. It was that quick and efficient. So it's designed to be as unobtrusive as possible for students as well. Just looking at some of the comments here, we've gotten some other questions. If a child is vaccinated and has no symptoms but tests positive, will they have to be quarantined? That is the case. Anyone who is a positive COVID-19 case would have to be quarantined. The difference this year is rather than the hard and fast 14 days, there are some different 14 days, 10 days, 7 days that could have that positive. And I should rephrase that. If you were positive for COVID, the earliest you could come back would be 10 days. Really good question. If you're vaccinated, you need to wear a mask in the classroom. We're trying to make a decision about that right now. As many of you might know, the CDC, IDPH, and Will County Public Health have made very strong statements about where we're at right now in terms of the onset of the Delta variant and are strongly recommending universal masking in all schools K through 12. Last night, we presented a plan to our board that will look at a number of data points. We'll include what the advice is. Our board adopted that it will take advisement from the CDC, IDPH, and Will County Health. We'll look at that data point in our community. We'll look at how many students we find are vaccinated, parents that are willing to put their vaccination records on record with us, how many people are enrolled in SHIELD. That'll help us determine, our total readiness to receive students on August 16th and make a decision about whether we start with masks or not. The warnings are dire right now. I've got to be honest with you and I have to be straight with you. The recommendations are very strong for universal masking. And again, our goal is to keep students in school, to keep 5 days a week going, and to avoid putting students out in a quarantine situation. And if masking is going to be critical to that, we'll use that mitigation. We don't plan on using it forever. We hope that it's as temporary as possible. But in some ways, that's going to depend on what happens outside the schoolhouse and what happens in our environment. I see that Janine Wheeler, thank you, Mrs. Wheeler, for answering. I'm just going to roll back over some of the questions and just make sure. Really good question. Do we know if students will be able to carry their backpacks again this year? Once we get beyond this week and set up, we will do a full message to you next week. Students will be able to carry their backpacks. And I just want to make a mention. It's a really great question. One, students also will be able to use their lockers in the morning and in the afternoon. We understand that students have things they need to stow. They need to stow maybe athletic equipment, maybe a coat, maybe an umbrella that they just want to put in their locker. The reason why we didn't use lockers last year is our lockers are awfully tight. We want to avoid students being close to each other. They will be able to carry their backpacks, and that just helps facilitate moving around the building in a quick manner and an easy manner for them. Some parents have raised, aren't backpacks, students carrying a backpack, a safety issue? Every year, twice a year, I participate in the National Threat Assessment Center's briefing about school violence for administrators. It's run by the Secret Service. And we do case studies. And the number one prevention of violence in schools is not limiting backpacks. It is creating a culture where our children will tell adults when something is wrong. Almost every act of school violence in the United States, someone knew before it took place that it was going to happen. And the number one prevention is if that's somebody who knows, usually another student tells. That's the number one safety. That's what we're trying to grow, is that trust with our students. And we would never, if a student shares that information with us, expose that student. We're just grateful we have that information. That's confidential. Another great question, and just trying to make sure I answer these. I'm going to go back. Brian, thank you. I'm going to answer about SHIELD and vaccinated students. Will they be eating lunch in other gyms? They will be eating in cafeterias. Because we can put students 3 feet apart, they will be in cafeterias. They'll be back at cafe tables with 3 feet of separation. We did not like the setup that we had to use last year. It was not very social. It was not very human. We will be, if we're in universal masking, for example, we would have to ask students to eat and then put their mask back on. When we get to that stage that I am anticipating, I know we will be at, where masking mitigation might be relaxed, we hope that that could be relaxed in lunch as well. But I want to get back to Brian's question. Can you explain, that's a great question. I apologize, just explaining it one more time. But if you're vaccinated, the advantage of SHIELD for you is if your child becomes symptomatic. If your child has something like a cold, and if you really, or a sinus infection. I have very bad allergies. I frequently get sinus infections. If I have a sinus infection, it will masquerade as COVID, and I will have to be tested in order to come here to work. The advantage to you is SHIELD testing is a quick way to rule out COVID, even though your student is symptomatic. So that's the advantage for vaccinated families. Certainly, if you say, this really isn't for me, we're vaccinated, we feel good about that, you could always have the option on day 5 or 6 of those symptoms of taking a PCR test privately on your own through your physician or a pharmacy and working your way back with a negative PCR test on your own. That's not ruled out at all. Apologize for the pause. You're probably tired of hearing me talk. Just want to make sure I roll back over the questions. And I see some things we're learning. The Delta variant, it is the case. We've seen vaccinated people who have become infected with COVID. At least what we've read in those cases, vaccination really mitigates the symptoms that people experience. So that's at least the advisement that. And then someone asked me, and I'll do that again. What's the benefit for unvaccinated students for SHIELD? The benefit for an unvaccinated student is an unvaccinated student, and this is not a positive COVID, but a student who's been exposed to COVID, outside in a private setting, inside school. We're going to try to keep people 3 feet apart so they're not exposed. Exposed to COVID, or has COVID-like symptoms and they're unvaccinated, they would have to go into quarantine. And the earliest that child could come back would be on day 8, maybe even 9, depending, if you're not in SHIELD, on your results. If you're in SHIELD, you could participate in something called test to stay, where you just more frequently test. You test on day 1 after exposure, 3, 5, and 7. As long as that child is negative, that child can stay in school. That's the advantage to unvaccinated students. Also, it just rapidly either rules for your family, your own peace of mind. It either rules COVID out or it rules COVID in. And if you're like me and our family, we had a number of just different personal situations where me and my children needed to know. We were doing some elder care. We needed to know if we had been exposed or contracted COVID. So, very quick was happening. I see a question about cost. There is no cost to you. There is no cost to the district. We have no financial relationship. The only financial relationship is between the state of Illinois and SHIELD of Illinois, University of Illinois. And that's true for every district in the state. Last night, someone astutely mentioned at the board meeting that the state of Illinois is certainly paying with taxpayer money. That's federal money. You might have heard of the different federal relief programs given to states, and that is federal money. So that would be accurate to say that the nation as taxpayers are ultimately paying for that, but there's no charge for you. And right now, there's nothing that's coming out of our budget to fund or finance SHIELD. It's one reason why we're involved in SHIELD. As superintendent, when the state is offering you a resource at such, a low cost, I hesitate to say free because, of course, we have to have labor and we got to put work in and you have to put work in, and taxpayer money at a large level is, of course, being used between the University of Illinois and the state of Illinois. But that program was going to be free to other schools, whether we enrolled or not. And if I can give our students and our staff an advantage, I'm going to do that. And if I can keep school open and students in school, I'm going to do that. Someone used last night a fancy word, malfeasance. I believe, really, to be honest, my personal opinion, to not take advantage of something like SHIELD testing just to set it aside would have been malfeasance. And like I said, I'm really glad that our board got behind it. We enrolled in June, set our school up so that we can deliver it as quickly as possible, and I hope get to a better place. There's a question: when decisions are made regarding masks, will it promote vaccinated versus unvaccinated students? Also, I don't remember when you said the SHIELD testing would take place. Great. We are avoiding, we really don't want any strategy that identifies walking in the hallway, identifies in a classroom the vaccinated student and the unvaccinated student. I know that some districts are using wristbands or lanyards. Difficult to enforce, maybe not great for a climate or culture, certainly not great for your privacy as a family. So when we think about masking, we definitely think about how can we maintain everyone's privacy. Just answering that question. And just answering, someone asked, when will SHIELD testing take place? We'd like to have a strategy where it takes place in the morning. The earliest might be a before school option for students, maybe during their advisory period, maybe during their lunch. And why in the morning? Because students should not eat an hour before they give a sample. It depends, though, on how many students enroll. If we have thousands of students enroll, then we're really going to have to think how we're going to do that. But what we don't want to do is, in your child's academic classes, use that academic time for SHIELD testing. That's our goal. We know how valuable that is. We do not want to interrupt that time. Like I said, the total process, walking to the room, giving a sample, walking back from the room, is about 10 minutes tops. The actual giving a sample is about 2 to 3 minutes. Just looking to see, cafeteria is great. Thank you. When decisions are made, thank you. Great question. Shield testing frequency is related to patient health or weekly interval. A little bit of both. Right now, Shield would recommend in our zip codes and in our county, given that we're insubstantial, that our participants test once a week. But if we have thousands of participants, and we're not going to be, saying, well, we've got to test once a week, so we're going to pull students out of class, we're going to interrupt their daily lives. We might have to stretch that out. The good news would be that we would still be getting good data about the level of infection among our students. And we would also develop another level that if a student's a close contact or has COVID-like symptoms, they can get Shield testing in sort of a different lane, if you think about it that way. We might have students who are every once in a while Shield tested through that protocol and that enrollment. But let's say they become a close contact, let's say they have symptoms, we would accelerate their Shield testing to try to keep them in school and hope that it's not a positive COVID infection, as a matter of fact. Hoping that I answered, the benefit. I think I'm, kind of going over keeping kids in school. Just taking a look at these comments. Someone asked about PE classes. Will be Strava oriented this year. I'm going to go ahead and take an answer to that. You're going to see PE take a step back towards normal. It's going to be a balance between two things. A lot of that has to do with how many students we can put in a locker room. We cannot 3 feet distance our students if we put every student in a particular class period into a locker room. So what you're going to see is in any class period, period 2 at East Campus, 50% of the students will be doing some of the mindfulness and resilient youth curriculum they did last year and probably using Strava maybe on that day. 50% of those students would be dressing and would be participating in the kind of physical activity you saw pre-pandemic. And then that would switch and our teachers would work that out. That's to maintain safe distancing inside the locker rooms so that students can change. Thank you for asking that question. Great question. Someone asked, I'm so glad I saw this. Someone asked, if I enroll my student, can I pull my student out? Absolutely. We felt it was important. The Board of Education felt it was important. Our leadership team, it is your choice as a parent. We did not feel that just like vaccination, a medical test that your child participates in should be your choice. This is not mandated by the Board of Education. This is not required. It's an option for you. And if you say, gosh, we've done this for a few weeks and, well, it just doesn't seem necessary for us. We feel safe. For whatever reason, we're no longer participating. You would be able to say, we're revoking our consent. Not a problem. We understand that you're making choices that you feel are the best for your child. Perfectly understood. And we support that. Not just understood, we support that. I think I have answered most of the questions in the chat, and I really apologize to anyone if you asked a question and I did not answer it. I hate to ask a participant to post. There was a question, what are the number of cycles used in this PCR testing? And I'm just not sure what that question is. And that question is either, asking me epidemiological information that I'm not qualified to answer, or means cycles might mean something that I don't understand. So the person who asked that question, if you could clarify that would be tremendously helpful. We are well over the half hour that I promised you. And I'm going to check at the very bottom of this chat just to make sure that I have not missed a question that was really important. And if I have missed a question, you could always ask it to me directly, rmcbride@lths.org. I'd be happy to respond. Couple just things, maybe just to summarize as we come close to 8 o'clock. History of Shield, developed by University of Illinois, one of the top research institutions, colleges in the state, in the country, in the world. Why here at LTHS? We want to keep school 5 days a week. We want to do everything we can to keep students out of quarantine. We want real, actual data about our students so that we can understand what's happening in our four walls as we make decisions about mitigations and procedures. We want to be as informed as possible and understand that. Why here at LTHS, we respect and we support the idea that parents can choose to have their child vaccinated or choose not to have their child vaccinated. But we feel a responsibility to have a backstop, so to speak, for those choices to keep students out of quarantine. How does it work? It works with your consent, and it works through protected information that's protected by the school and protected through a parent portal that you would be a part of. When would your student do it? Generally in the morning. It's about a 10-minute process walking there, about 2 to 3 minutes to give a sample, walking back. Your student is the only person who touches the vial from walking in to drooling to depositing it for it to be transported to a CLIA licensed facility. When you receive a report, we will only act if it's positive. And when you receive a report, you'll be told when the specimen was collected, where it was tested, and at what time. And if that facility, it should be CLIA licensed. Its CLIA license number would be there. And again, this is a secure portal. Just to share with people, a number of people asked, well, couldn't you just walk up and say, hey, I want a shield test? That security comes with a sign-up period. And that's why walk up would be difficult to do, not to keep anybody out at all. Some people asked, if I sign up now, can I withdraw? Absolutely. Other people asked, hey, if I don't sign up now, can I sign up later? Absolutely. We would make that work. There's benefits to be to both vaccinated students and to unvaccinated students. And then finally, I would really recommend, and I maybe should have said this early, go to Shield of Illinois. Just Google Shield of Illinois. You will land on a very robust, a very informative website, videos. You've got parents talking, teachers talking, scientists talking, a description of how Shield detects COVID-19. And don't take it from me, discover it for yourself. And I think that would, knowledge is power for you to make your decision. Yeah, Candace, thank you very much. I don't particularly like the phrase drooling. It is the phrase that Shield uses without getting into all the nomenclature, just because it's probably the most accurate. So I don't like using that word myself. One of the things that I will tell the remaining participants on is that we will include much of this information about Shield in an updated FAQ that will be on our COVID-19 page next week. So we'll pull that all together. Happy, thank you, Joe. I'm happy to repeat things, and I'm sorry for any way that I was unclear. Sometimes I can get ahead of myself reading the comments and trying to communicate with you. So thank you very much. I'm looking at the chat and just pausing. Want to make sure I've answered all the questions that I can. I'm going to put in the chat just, I am R. McBride at lths.org. And my direct phone number is 815-588-8105. And I'm going to let that hang out there. It says public relations, but that's me. I'm just on our public relations channel. But if I failed to adequately answer something, it's likely if you email me, I might phone you back, because I sometimes find that a communication, via a talk is just so much better than an email. But if I've fallen short tonight, or, we end this webinar and you say, gosh, I still have a question. We're here to serve you, and we want to do that. Hey, thank you so much. We had well over 100 people here tonight. There's no way you can get this hour of your life back. It's a summer night, and I know how precious those are. So on behalf of our Board of Education and our leadership team, we are trying to keep school open. That is our primary focus. That's what we're trying to do this whole year. And really, we're hoping 5 days a week, every single day, that we are here and that we are doing school on behalf of your children and behalf of our educators. Um, so I'm just thankful that you are partnering with us, and thankful that we can provide this for you, and thankful more than anything else for your time this evening. And I just always say this: you are all obviously parents who care about your kids because you're devoting this time. And the bottom line is, without you, we couldn't get anything done. Your children's first teachers, and we respect that, and we acknowledge that, and we appreciate that, and understand that you're doing your homework at home as parents. We're trying to do our homework here at school, and get the best grade we can as we work with you. So, yeah, Kathy Vroom asked, how do we enroll? Kathy, I believe on our COVID-19 page, we sent out an email with the letter from me and the form, but also, if you're going to be joining your child at freshman orientation or at Welcome Back Days, the forms are right there. So you could just walk in and say, can I have the Shield forms? We provided them online in case a parent isn't accompanying a student or would like to fill them out in advance. So that's how you can enroll at freshman orientation or Welcome Back Days. So thanks so much. Have a great evening. I'm going to give a 5, 3, 2, 1 countdown to ending the stream. Really appreciative for your participation tonight and being with us. Stay safe, be well. We are so excited to start the school year, and more than excited to see your students. Janine Wheeler just put in the chat some helpful information. I'll keep that open. That's our COVID mitigation page. But again, I would really recommend you go to Shield of Illinois, Google it. It's a very rich website. It can also assist you with making decisions that are best for your family. Thanks so much. Have a great evening.